Fox 32 News at 9 starts now.
And good evening, I'm Jeff Herndon.
And I'm Dawn Hasbrook. We are following breaking news from Chicago's Streeterville neighborhood. We have reports of a level 1 hazmat situation at 207 East Ohio Street. That's about 1 block off of Michigan Avenue.
At this point, we don't have much information. What we can tell you is that authorities are dressing in hazmat suits to enter the building. We are awaiting more information.
We have a live crew headed to the scene. We will have a live report in moments. In the meantime, it is another night of major developments. The first nurse infected with Ebola in Texas is in Maryland tonight. Nina Phan was flown to a special isolation unit outside Washington, D.C. She is in good condition. President Obama says he may consider appointing an Ebola czar to oversee the government's response to the disease. The CDC says the other nurse who flew from Cleveland to Dallas may have been sick earlier than we thought. That would be a major concern for everyone else who was on the plane with her. And a false alarm at Yale. A graduate student there had symptoms after visiting Liberia. But officials tonight say the student does not have Ebola.
Doctors and nurses at Rush University Medical Center are preparing for any and all Ebola cases that may come through Chicago.
Like Emory University Hospital in Atlanta, Rush could serve as ground zero for treatment in our area. Fox 32's Craig Wall continues our coverage with the steps the staff will take.
With the Ebola threat on the minds of nearly every healthcare worker, those at Rush University Medical Center are now practicing the critical steps of putting on and taking off their protective clothes and equipment.
You want to tell each other that make sure you keep your gloves away from your face.
The protective gear includes boots and gowns that are impervious to fluids, 2 layers of both gloves and face shields, as well as a hood. Duct tape will be used to seal openings around the wrists and the hood. The doctors and nurses will use the buddy system to double check one another, and there will be a third person to go through each step of the safety checklist with them. Only a limited number of people will be involved in any Ebola response.
It's really just a group of 21 core nurses who are prepared in intensive care, and then we're going to have a group of physicians that are going to work together around the clock to provide care for the patient.
Now, be careful with your gloves.
The biggest potential for spreading Ebola comes when healthcare workers have to remove their protective equipment after treating a patient because it could be contaminated.
It's really about being slow, so it's slowly removing each item and using bleach wipes in between each layer of removing gloves and putting on new gloves and removing everything very slowly so you're not aerosolizing particles into the environment.
Remember, you're clean, so you're only touching the clean, and he's touching the dirty.
Rush plans to keep adapting precautions as needed and as new information about Ebola develops.
I feel more comfortable. I think I need to practice again. This is my first time actually doing this, so practice, practice, practice.
The CDC has not designated any hospital as a primary Ebola facility, but Rush has been mentioned as a possibility. Now, in addition to drilling employees to be ready, the hospital is also creating a special isolation unit within the ICU that would be used to treat the Ebola patients. Jeff?
All right, Craig, thanks. Screening for the Ebola virus has come to O'Hare. Health officials and customs agents this morning started taking the temperatures of people flying in from West Africa. They're specifically interested in flights from the Ebola hot zones of Liberia, Guinea, and Sierra Leone. Officials say up to 25 passengers a day come through O'Hare from those countries.